Alright, today we're going to be assessing an epidural, and this is our patient, Mrs. P, and she's pregnant and is having a lot of pain. And you can give epidurals for two reasons, either acute pain, like when she's going to have a baby, or surgery, abdominal surgery, anything like that. When they remove a lung, they also give an epidural. And chronic pain, like for children who have cancer, or they're undergoing hip and back surgery. So there are many reasons they do it.
So the first thing that we're going to be doing when we have a patient who has an epidural is we're going to check the med order. We're going to check the patient's chart with the med order, and we're going to check for inconsistencies. We're going to make sure that this is the right patient, that it's the right medication, that it's the right amount of medication to be given, that it's the right route, and that it's the right dose, and we're giving it at the right time. So to identify the patient, we're going to be checking their armband with their date of birth. We also want to make sure that these are the same as what's on the order. Next, we're going to show the patient the device, which would be the epidural that is going to be put on them, as well as the infusion device. What we're going to do is we're going to explain the function and the reason for the device. Obviously, for this patient, they're going to be having an epidural for the acute pain of pregnancy and labor. This is going to be, the epidural will be inserted at the L4 or L5 vertebra, or as the anesthesiologist prefers. So first we're going to provide privacy by shutting the door or pulling a curtain. Our curtain is pulled. Next, we're going to make sure to perform hand hygiene and put on gloves. Earlier, when we were checking the med order, you would make sure that the patient had no allergies to the medication that was going to be given. You would want to make sure, if they do have allergies, that they have on a band that says what their allergies are. Then when you come in and you are actually assessing the patient, you want to ask the patient if they're in any pain. And this is something that you would want to document, and so we could reassess after the epidural has been started. Next, we're going to be assessing lung sounds, respirations, blood pressure, and temp. Essentially getting baseline vitals prior to the epidural administration.
Alright, Mrs. P, can you tell me your name and your date of birth? Alright, Mrs. P, 10/31/87. Do you have any allergies of any sort, any medication? Doesn't have any allergies, so that's good. And I'm going to listen to her lung sounds.
It would be normal for a patient who's having acute pain to possibly have increased respiration, increased blood pressure, to have a quick heart rate. All of these things may be normal for someone who's having acute pain, and what you would want to make sure is that these things are decreased after the epidural is given. We want to make sure before we're giving an epidural that we always have an ampule of naloxone and a syringe at the bedside. If you can see from our picture, we actually have the syringe pre-mixed and taped to the epidural infusion device to make it handy for any nurse that may be taking care of this patient or healthcare provider that comes in the room in case of respiratory distress or respiratory depression for our patient. The naloxone is to reverse the respiratory depression in a patient. So after you are done taking all of the patient's vital signs, you would make sure to chart this and have a complete record. Next, the anesthesiologist would come in to insert the device and would initiate the infusion device. So after the insertion of the device, we would come in, we would check the label on the medication. You would also check the rate and the med with your MAR and with the patient identification to ensure that the anesthesiologist correctly set the pump and gave the medication. You would also want to obtain verification of this information from a second nurse.
Kelsey, can you confirm?
I can confirm correct medication and correct patient and correct rate. So then what you would want to do is you want to make sure that all connection sites have been taped. On our patient, the connection sites, and on most patients, it's going to be on their lower back. If you turn the patient, you can see that all of the sites have been taped. You're going to want to assess the site while you're making sure that everything has been correctly taped. You're going to want to look for redness, edema, pain, or swelling. You want to make sure that all sites are correctly taped and stable, because you do have a patient, especially our patient, who may be moving positions later on and who has the risk for dislodging the device, which you wouldn't want them to do. So you just want to make sure that it's stable and correctly positioned.
Mrs. P has no redness or swelling or inflammation around her site. There's no drainage. And we came up, the anesthesiologist taped it up here on the chest, and that's what we'll be giving it. And we want to make sure there'll be a transparent dressing over it, so we can always see it at all times.
You would want to make sure that the bag and the tubing connected to the pump were labeled with the date and the RN or anesthesiologist initials. You would also want to make sure that the epidural infusion device is labeled with some sort of sign that says for epidural infusion only. You would not want to administer any other narcotics or adjunct drugs without the physician's approval of the doctor that inserted the device. You're going to want to continuously monitor the infusion device's rate throughout the day as you're taking care of the patient to make sure that the device is properly working and they're getting the proper amount of medication.
Mrs. P, are you having any more pain since we've given you the epidural? She's having a 6 before, it was a 10, so that's very good compared to 4.
So you would definitely want to make sure, as Olivia has done, to reassess the patient's pain level. You would also want to assess and record the patient's sedation level and respiratory status every hour for the first 24 hours, then at 4-hour intervals after that. You would want to notify the physician if sedation level is 3 or 4, if the respiratory rate decreases, or if the respiratory rate falls below 8 breaths a minute. You would want to make sure to always keep the patient's head above 30 degrees. You would want to assess the patient's level of pain on a 0 to 10 scale and the effectiveness every 30 minutes post-infusion of the medication. You would want to constantly monitor the urine output and make sure that it's at 30 milliliters an hour. You're going to want to assess the patient's motor strength every 4 hours.
Can you squeeze my hand?
Often after an epidural, they may have decreased sensation or ability to move their lower extremities below the infusion site, so that would be a normal assessment finding. Then you would want to monitor for adverse reactions such as pruritus or nausea and vomiting. You would also want to continually assess for signs of infection such as redness, swelling, or temperature. You would change the dressing every 24 to 48 hours using aseptic technique or per facility protocol, and you would want to change infusion tubing every 48 hours. Once you are done caring for the patient, you would remove your gloves and perform hand hygiene. And you would know that this procedure has become effective when you check the site and it remains free of infection. You have correct meds given at the correct time, 5 rates for the patient. The patient has relief of prior pain symptoms, and the patient understands the reason and functioning of the catheter. They've decreased anxiety, increased ability to cope with pain, pain relief, a dry intact dressing, and no signs of complication, injury, or infection.